Hey everyone, today we're going to be doing a sample step 1 and step 2 question. So our patient is Vicky. She's a 64-year-old female. She has a limited past medical history, but what she has is notable for hypertension and gout. She presents to clinic today with her husband, and she has two primary complaints. One is worsening memory, and the other is inability to perform certain activities of daily living. And all these symptoms started about 3 months ago. On examination, we noticed that Vicky has intermittent jerky movements, and then we did a brief mental status examination, which showed that she has inability to recall objects at 5 minutes. So, in terms of our patient, essentially the main symptoms that we want to highlight is that she's been having these memory issues, and as a result, she's also unable to perform some ADLs, and these have been pretty rapid in onset, and they started about 3 months ago. And along with our examination, we also noticed some jerky movements. So, in terms of the potential options, in terms of what may be going on, includes CJD, which stands for Creutzfeldt-Jakob disease, which is a prion disease. We have Alzheimer's, Lewy body dementia, and vascular dementia. Go ahead and take a few seconds to pause in case you need more time. So the answer in this situation is Creutzfeldt-Jakob disease. So there are two reasons why. So for this patient who's having these memory issues, there are two primary reasons why we think it's Creutzfeldt-Jakob as opposed to any other things that can cause memory, dementia, and a lot of those symptoms. One is the rapid progression of symptoms. Creutzfeldt-Jakob is a prion disease which tends to have a very rapid onset, and unfortunately, as a result of that, patients tend to die relatively quickly. And so, from the question set, we noticed that the patient or the symptoms started a few months ago, whereas with things like Alzheimer's and Lewy body dementia, those things tend to happen over the period of a few years, whereas Creutzfeldt-Jakob, once again, is a very quick onset. That's one reason that we think it's CJD as opposed to some of the other options. The other reason we also know it's CJD is the patient also reports intermittent jerky movements. That's also a characteristic hallmark of Creutzfeldt-Jakob disease. So once again, the two key takeaways that I want you to learn from this question is that for patients with Creutzfeldt-Jakob disease, they have cognitive issues with a very rapid onset, and along with that, you also very frequently have myoclonics or the intermittent jerky movements that we see in the questions. The rest of the options, Alzheimer's, Lewy body dementia, vascular dementia, and a few other options, I'll go over in the next slide. So Creutzfeldt-Jakob, I'm not going to go through it since we just went through it. The first one, in terms of a patient having memory issues, the first thing you should think about is Alzheimer's. Alzheimer's is the most common cause of dementia that elderly patients experience. It's, I believe, it accounts for about 80% of the cases. And the key point I also want to make is, especially given the fact that we just saw a Creutzfeldt-Jakob patient, is that in comparison to that onset of Alzheimer's, it happens over the course of several years. Age is the biggest risk factor for developing Alzheimer's, and it's rarely seen in patients who are younger than 60. And another key aspect of Alzheimer's is that one of the most common presenting symptoms is issues with memory. And the one key thing you should also know about that is often these issues with memories, patients themselves may not notice it. So it might be someone who's close to a patient who may report that, I'll tell this patient a story several times and they'll keep on forgetting it. The patients themselves often don't even realize that they have these memory issues until someone else might point it out. Um, and then the other important thing to remember is that even though patients of Alzheimer's, memory deficit is the most common presenting symptom, it can also impact other cognitive domains, including having behavioral issues. Next, in our differential for patients who have dementia, you should also remember Lewy body dementia. And the key thing to remember for that is, along with having these cognitive issues, they have visual hallucinations. That's a hallmark for Lewy body dementia. Next is we have frontotemporal dementia. The key way I want you to remember this, as opposed to some other causes of dementia, particularly Alzheimer's dementia. So, as we discussed a second ago, with Alzheimer's dementia, the most common symptom is memory deficit. In comparison to that, with frontotemporal dementia, the thing that we tend to see most commonly is behavioral abnormalities. So, for instance, a patient may have issues with anhedonia, may have issues with depression. So that's the most common symptom that we tend to see in frontotemporal dementia. Next, with normal pressure hydrocephalus, the key thing that you want to remember is wet, wacky, and wobbly. Wet, once again, stands for urinary incontinence. Wobbly stands for issues with ataxia. And then wacky refers to some of the issues with dementia and other cognitive issues that they have. Next, we have vascular dementia, and the basic idea behind that is patients that have a series of strokes, and as a result of a series of strokes, you see this stepwise decline in cognitive function. And so, the last category that I want to mention with regards to dementia and cognitive issues is kind of a catch-all, which is that there are a lot of other potential things that could also be. Depression, in particular, is one very important thing you want to make sure you rule out. Is that, especially amongst elderly patients, depression can often mimic dementia. But the good thing is, the reason it's very important to make sure you rule this out is depression is reversible. And then another category that I wanted to include on there is metabolic. So often metabolic encephalopathies can also cause these cognitive issues and dementia. So overall, I feel like this provides a very good overview in terms of some of the potential causes. Once again, just to go over, just to provide a quick overview once again, is that anytime you have a patient with dementia, the most common thing that you should be thinking about is Alzheimer's. If a patient has issues with cognitive issues and they have visual hallucinations, I want you to think of Lewy body dementia. If they have issues with behavioral symptoms, I want you to think about frontotemporal dementia. I want you to think about vascular dementia if they have a history of strokes. If the patient has very rapid onset of symptoms, I want you to think about CJD. And lastly, for patients who have NPH, just remember that wet, wacky, and wobbly. And hopefully this provides you a good overview of how to tackle a patient who has dementia.